A recent study conducted by the Kaiser Family Foundation shows that although many young students say they think health insurance is important, nearly 80% know little about the Affordable Care Act or the new insurance marketplace. Organizations like the Young Invincibles are launching nationwide education campaigns to help inform students about the Affordable Care Act and to assist students with the new marketplace. Michael Fauntroy, an associate professor of political science at Howard University, says that the Affordable Care Act offers important benefits for young people, especially college students.
Well, the Affordable Care Act is one of the most complicated public policies that come through in a number of years. Among the most important characteristics are it allows kids to stay on their parents' health insurance until age 26. That is a huge benefit for millions of young people.
But what happens to students who aren't on their parents' plan and don't want to purchase insurance through their school? Beginning in 2014, these college students will have to abide by the individual mandate that requires most people to obtain insurance under the Affordable Care Act or pay a tax penalty. This has many people questioning just how accessible and affordable these health care plans are for college students.
Even if you don't have a lot of money, there are stipends and financial inducements that are provided by the government to help students and other young people, college-age students, for example, get health insurance. So even though you do have to go out and pay for it, you don't have to pay very much for it right now.
Unfortunately, it's a benefit that many young people are uninformed about, which is alarming considering that getting young Americans to sign up is crucial to the success of the federal health care program in order to offset the cost of health care for older Americans. Professor Fauntroy says most citizens have no real knowledge about the Affordable Care
I
Act.
think the overwhelming majority of American citizens have no real idea what the Affordable Care Act, and that reveals some of the great sort of efforts that have been undertaken by Republicans to undermine the law. A lot of people believe things that don't actually exist.
Late night host Jimmy Kimmel recently conducted an experiment to show just how uninformed Americans really are.
To conduct an experiment today. We sent a camera crew out on the Hollywood Boulevard to ask people which they thought was better, the Affordable Care Act or Obamacare. Now, as you may know, Obamacare is just a nickname for the Affordable Care Act. They're the same thing.
I decided to take to the streets to conduct my own experiment to see just which one college students preferred, Obamacare or the Affordable Care Act. So do you prefer the Obamacare or the Affordable Care Act?
The Obamacare.
Okay, and what exactly do you know about Obamacare?
That is something of the government that is helping if we are, I know a little bit, just a little bit. It's like an insurance, but it's not insurance.
I don't know too much about them really. I know, basically what I know is that there was a big problem with the healthcare website, and I just know about all the controversy about that, but I don't really know about like the deeper like issues with it.
Which piece of legislation do you think is better, Obamacare or the Affordable Care Act?
Well, they're both the same piece of legislation. Okay. I think that it's unfortunate that there's been sort of a negative connotation associated with both of them, although polls do show that when you refer to the Affordable Care Act as the Affordable Care Act, its popularity does rise significantly compared to being called Obamacare, which I think is indicative of the fact that a lot of people's concern with it is more driven by the rhetoric rather than the actual substance.
After countless interviews with college students on a number of campuses, I realized that very few, if any, had signed up for the program. Many students were already on their parents' insurance, while others just found the process to be too complicated.
None of my friends really know anything about it. Half my friends didn't even know that it was an online database type thing. And then my parents already, I guess, have health care. And then my siblings are older, but they're not 27 yet, so they're still underneath my parents' health care.
To have a piece of legislation that is so complicated but so vital, it's not working out. And it's not that I'm saying that like the motives and the reasons are not there, but the fact is simply in realistic terms, it's just too complicated.
Although the Affordable Care Act did not affect the majority of the students I spoke with, this was not true for Georgetown senior George Schmidt.
Like we were going to be without health insurance. And the only reason I'm on health insurance now is because I'm a college student and it's mandatory and the university offers it. But if it weren't for me gaining a job at Goldman / if I was being able to be like kind of get grandfathered under that, I would have had to sign up for it. And my sister is definitely probably not to get signed up for it.
For News Vision, I'm Jalen Marcel.